just thinking about that question specifically, I think the biggest piece is having grace with yourself, recognizing that you're not necessarily going to do everything perfectly. And I think being graceful with yourself in the pursuit of balance and the pursuit of integration with the multiple tasks that you have, I think it's being just graceful with yourself. And then also just recognizing your breaking point. Something that I like to always highlight in a visionary leadership and resilience e-course that I have is being self-aware of where you feel like you've stretched too much, because that gives you the permission to know when you need additional help, when you need to set boundaries, when you need to set parameters, and even when you just need to pause and take a minute for yourself. I think the great piece of life is that it's a journey, it's a pursuit. It's not always a sprint. There are moments that you have to sprint. There may be moments where there might be a lot of things that are happening all at once, but giving yourself the permission again to create that balance as you move along is just very helpful in setting that foundation. So I think just really assessing yourself, again, as nurses, we are great at assessing others, but even just being aware of ourselves and saying, you know what? Is this stressing me? Do I absolutely need to do whatever this thing is? Is this something that is going to, change the trajectory of what I'm doing, or could I just wait on it? And then just recognize that, timelines can be fluid, and then balancing it in that way. And that, whatever that priority is, if you can give your all to that priority thing, then it helps you feel like you fulfill what you need to do. So that's a little bit of a springboard in terms of the jump point. And obviously there's a lot of different concepts, but just recognizing that balance, pacing yourself, being aware of your own self and your own breaking points, and then just having grace with yourself.